Welcome to Straight Talk. This is Eugene Chan. Our guest this week is Hospital Authority Chairman Mr. Henry Fan. He has held this position since December 2019 and was recently reappointed in December. Mr. Fan is a barrister by profession and has also had over 30 years management experience with large corporations plus a long public service record in Hong Kong. Tonight, Mr. Fan is going to give us an update on how our public hospitals are coping with the fifth wave. Welcome, Henry.
Thank you, Eugene. Thank you for having me.
Chairman, we have been reading a lot of disturbing reports in the news and TV that with the hospital authority that with the public hospital they'll be running out of oxygen. We have overcrowded wards so that it's very difficult to maintain hygiene. The nurses have to move beds around in order to get to the patient and change the diapers. The ward smells of human waste because we have many elderly patients wearing diapers and also bedpans, and there are not enough staff to clean them. There's also a photograph in a recent paper last week in the Standard that there are wards with patients in the beds where next to them there are some presumably bodies in body bags on stretchers. All these are very disturbing sights, and as we know, since the chairman is here, we'd like to ask you, is that true?
I think it's largely true, and we are very sorry that this has happened.
Right.
But the fact is, the fifth wave hit Hong Kong so hard and so sudden, and the number of new cases were soaring so exponentially that for a while, the hospital authority was caught by bottlenecks and backlogs, you see. But we are working very hard. We have been working very hard in the last few weeks to try to map out a strategy forward.
Right.
And if I can explain to you briefly what we have in mind, you see.
Okay.
We have adopted multi-pronged approaches. Firstly, we are increasing the number of beds substantially. Now, before the fifth wave, we had a total of about 3,600 COVID beds. Today, there are about 12,000 COVID patients at our hospitals. So you can see that in the last few weeks, we have increased our number of beds by roughly threefold. And this is continuing. Thanks to the help of the central government and the SAR government, more beds will become available very soon in the next few weeks. For instance, the central government is building an emergency hospital at the Chet Lap Kok Loop, which would have 1,000 beds, 500 phase 1, 500 phase 2. Now that hospital will be able to take on serious cases. The Hong Kong government has been using community halls, converting them into makeshift hospitals. And the Kai Tak terminal, cruise terminal, is about to be completed with about 1,200 beds. Now that would be very useful for our elderly patients. So we are proactively dealing with the shortage of bed problem. That's number one. Then secondly, we have also an acute shortage of manpower. Today, we have about 90,000 staff, colleagues, of whom about 15,000 are now down because of COVID. And of these 15,000, roughly about 7,000 have returned to work, but still a substantial part of our workforce is out of work at the moment. So that is why the scenario you mentioned happened, that we're short of manpower, see. So what we are now doing is, we have, through the SAR government, sought the help of mainland medical team. And they will be coming very, 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 very soon.
Okay.
We have sought in terms of number in thousands.
Okay. So we're talking about beds, manpower. What will be the next prong? Yeah.
And then the next prong is we are seeking to improve our treatment.
Okay.
And this is done in the following manner. Firstly, we have designated basically one hospital in every cluster. We have 7 clusters. So we are designating in every cluster, one hospital, to be a COVID hospital. Now this would help us to concentrate patients, particularly serious cases, manpower, our best clinicians, resources to deal with all the heavy cases. So there would be 7 hospitals throughout our 7 clusters. This has already happened. You probably heard about Queen Elizabeth, just completed Sunday to become a COVID hospital. So this would improve our treatment. Secondly, for those mild cases, for those patients who are confirmed but do not need hospitalization, we have designated clinics. There are, from this week, there will be 23 of them. Given a daily quota of about 40 to 100. Now they can ring up, they can walk in, and they will be treated. They will be given medication as necessary. And incidentally, as you know, more oral drugs have just arrived from Hong Kong. So we were able to serve them with that.
So far you've talked about the improved medical care, the beds, and also manpower. What will be the next prong?
Well, the next problem is we are also reviewing all our medical supplies. We are increasing our stock on PPE, ventilators, oxygen concentrators, etc., and of course, medication.
So, Chairman, I'm sure the viewers, after listening to your 4-pronged approach, will be very assured that you have everything worked out and it sounds very sensible. So, what we saw a couple of weeks ago, where we see hundreds of patients staying out in the cold, waiting, there was cold weather then, waiting to be admitted to the hospital, that shouldn't happen anymore, should it?
Well, we would be doing our best to cope with the situation. But you appreciate that hospital authority resources are limited. Manpower, beds, all limited. So a lot depends on what happens next.
But we know that the cases of Omicron in Hong Kong has been overwhelming and unprecedented. But looking at other countries that had the Omicron hitting, we should expect that happening. Would you say that the hospital authority was caught off guard or was able prepared, as some people have suggested?
Well,
what do you say to that?
Let me put it this way. Before the 5th wave, we had 3,600 beds. And most of the time, they were left empty. So at hospital authority, we had to make a choice because every option, Eugene, has a cost. Now, when I told you that we have increased our beds substantially, this is at the expense of cutting back our non-essential services.
That's understandable,
So we now operate only basically 40% of the non-essential services. So at the end of the 4th wave, when you are sitting there making a judgment, you would have to decide, do I prepare so well for the next wave that I continue to cut back our services? Or what do I do? At that time, the decision taken was we would resume full services.
So, Chairman, I'm sure the viewers will understand everybody is working very hard, and we pay salute not only to the frontline healthcare workers, but also to the management. I'm sure you have endless meetings, endless hours.
Thank you.
I'm sure you have tried your best to fight it. Do you think our workers have been limited by the system? That we have been, hands are tied because, for example, we have all these rules. If you're having infected, you've got to be isolated. If you have close contact, you can't be at work. So, because of our protocol, we have even shorter staff than ever. Would you agree to that?
Well, it is of course true that the shorter the isolation period, the better it is for our workforce. But we have to abide by the Department of Health regulations.
What's the staff morale right now? Are they still high?
Well, I'm happy to say that generally speaking, staff morale is high. At least we have not seen anybody quitting over this COVID.
But you know,
staff are dedicated, very professional, and they're doing their very, very best to cope with such a difficult situation.
Chairman, as soon as we tell the viewers that you're coming, I've received a lot of phone calls. And one of the viewers said to me that he's very disturbed when he saw one of your emergency A&E consultant. When they meet the public in the press, he just can't control himself. He kind of break down in despair, feeling very helpless that all his colleagues are working very hard, but not being able to save all the severely ill. I mean, what do you say to them? What would you say to them?
Well, Dr. Ho has an excellent reputation among the colleagues. He's very well respected.
Right.
And indeed, the situation at Queen Elizabeth Hospital in the last couple of weeks, before we turned it into a COVID hospital, was practically impossible because they were overwhelmed with admissions at the A&E and so forth, you see. So what I would say to Dr. Ho and his like is, thank you very, very much for your dedication and professionalism. We are doing everything we can to help ease your burden, and help is on the way.
Okay, let's have a break and don't go away. We have been talking to Hospital Authority Chairman, Mr. Henry Fan, who has given us an update on how our hospitals are being stretched to the limit by the pandemic. So, Chairman, thank you for your reassuring words to Dr. Ho and all your fellow staff. And let's talk about yourself. I mean, you have been also criticized by some of the decisions that HA has made, being the chairman. And I'm sure many viewers do not realize your job is a pro bono one. But you still have to deal the same responsibility. I mean, being in public service, I fully sympathize with you. I'm sure there are moments that you can be discouraged, but what are the motivating factor to make you continue to lead the team?
Well, Eugene, I've been in public service for a long time. Right. And pro bono or not is not a reason or an excuse not to do your job properly, you see. I believe I have served Hospital Authority with dedication. Right. And I have been, together with my team, doing our best to hold this last line of medical defense for Hong Kong. And I shall continue to do so. Right.
And in a media interview earlier, you mentioned that the Hong Kong medical system is doing fine. We have enough resources. We don't need any help from the mainland. But you were criticized for taking that stance, and a few days later, you would change your approach and say we will need help from the central government. What makes you change your thinking in such a short time?
Well, development. Because when I was interviewed, the upsurge was only talking about 1,000 cases or so. Then suddenly, it goes into 5 figures, you see, so situation is completely different. And in fact, all along, we have been discussing with government on how we can seek help from mainland. See? So it's not really a change of attitude at all. Right, yes. And even in that interview, I did say that as and when necessary, we will, through the SAR government, seek help from the mainland in the same interview. Right. So I would say I was taken out of context.
So, Chairman, as a public citizen in Hong Kong, we all want to help and support the Hospital Authority. And I know we have been warned not to go to the A&E department just because you have a slight running nose or cough. But what should people do? If they are unfortunately having, with the red test having a positive, should they still go to the Hospital Authority?
Well, at the moment, I think we have, both government and us have widely publicized the criteria for hospitalization, which is we are reserving hospitals for the most needy, with critical and serious cases. Right. And there are guidelines as to what is considered serious or critical, which we have well published on our website and also on our hotline and so forth. So those who need hospitalization, particularly the elderly and the children, will be given priority. They should go to hospitals. Those mild cases, they would be treated at what is called the Community Treatment Center at AWE near the airport. And yet, milder cases could go to the community isolation facilities where we would put a medical post there.
Right, so what you're saying, HJ is not closing the doors on positive cases, only when you have serious symptoms, you have to be hospitalized.
Anybody in the lower categories can anytime call us, get an ambulance if their condition turns serious.
Right, there's also, I mean, I have to keep on asking about news report because there's so much news on Hospital Authority. Recently there was an expatriate lady that have an 11-month-old baby that tested positive, have to be admitted to the hospital. But then she wasn't allowed to stay with the baby. And that's understandable because the mother is very stressed that the child is having COVID. Not to mention they will be in a completely new, unfamiliar environment, and separation from mother doesn't help. So what is the current strategy or policy?
Well, Firstly, we are very sorry that this had to happen. Hospital authority always adopts a policy of pro-family and pro-child, because we believe that effective health care needs parental and family support. In fact, I think that the right of a parent to accompany the child is sacrosanct. Now, a few weeks ago, because of the sudden upsurge of pediatric patient cases, there was an overcrowding in the pediatric ward. So much so that we could not afford to have parents also accompany their children. Situation since then has improved substantially. We now have more elderly patients than pediatric patients. So we are now able to basically accommodate all parental requests to accompany their children.
So Chairman, another view, I mean, one of our doctors in the Medical Association, Dr. Paul Scheer, he said in Mingpao, one of the newspaper, he said one of the reasons from his point of view, that is not working well is because you have a lack of primary care doctors in the hospital authority system. And he also said that there are like over 6,000 medical doctors right now in the private sector that because of, people aren't quite scared of coming out to the street, and that a lot of people are not seeking medical care. So we have a lot of underutilized medical workforce in the private sector. And actually, Premier Han Jing was saying that you should work with a private hospital. So have you have any plan to recruit the private practitioners to kind of give you guys a hand?
We have been appealing repeatedly to the private sector to help us out. We've been trying to recruit as many as possible. Some have responded, but it's far from the figure you mentioned, the 6,000. And we have also been appealing to private hospitals to let us have more beds. Even if we do not agree to take COVID patients, we hope they will give us some non-COVID beds so that we can transfer some non-COVID patients to them. But I must say that today the reaction has been disappointing. The private sector has 5,000 hospital beds. Today, we have received a pledge of less than 300.
Really?
Yes, and we have only been able to transfer less than 200. So, but things being as they are, the hospital authority has no authority to force private hospitals to accept our patients.
When I just mentioned about Premier Han Jing, he mentioned that on last Monday, he was saying that, the medical workers, even the private hospital, should be responsible in that. So have you seek help from the Hong Kong SAR government?
Of course we did. And since the Premier spoke, the Chief Executive has also spoken. And the Secretary for Food and Health have also spoken to the private hospitals. Which is how we came to this figure of
300.
Of less than 300.
That's
before it was even worse. Before it was only double digit. Now at least we have a pledge of about, I think, 270 beds. And today, I think about 160 have moved in, and we're still discussing. Because
do they have any difficulties of doing that?
Well, I think they have some selection criteria as to what patients they want to receive. And that is where the difficulty is, you see. But I hope they would become less selective after Hunting has spoken, after and Kerry has spoken, and after Sophia has spoken.
So hopefully something will be better after this show.
I hope so.
Yes.
I hope so.
And also, initially, the hospital authority was allocating like 30% of the bed to be to cover the COVID patient. They increased to 90% after Mr. Liang, Dr. Liang from the expert panel came, the epidemiologist. So I've read in a recent research in the Hong Kong U paper recently, they were saying that if we increase the beds to like 90% of the beds looking after the COVID patients, the death rate will decrease significantly. Do you agree, and is that possible?
Well, I'm not an expert on the clinical side, so I cannot comment on that statement. But as I said, you see, at hospital authority, we need to take a decision to take care of the welfare of the people of Hong Kong. Now, already with 50% conversion, as I said, we have cut our normal services to only 40%. If we have to cut to 90%, what it means is even the emergent services we may not be able to maintain. So that is not feasible.
It's not feasible. Yes.
It's not feasible.
Right. So far, unfortunately, we have over 3,000 patients who unfortunately died in this wave, and a lot of them are unvaccinated or long-term illness, a lot of elderly patients. And compared to other countries, I think this mortality rate is quite high. Have you considered, like, for the high-risk patient, giving the oral COVID-19 drugs like the Paxlovid? Have you ever considered that?
For sure. We now have an outbound team going out to visit elderly homes and handing out oral drugs as necessary. And the same would happen with our designated clinics. They would also hand out drugs as necessary.
Right. One comment, maybe, hopefully you can let the viewers know. One of our lawmakers, Elizabeth Quat, who chaired the Legislative Council panel on health services last session, said the government should have seen the situation and make plans well in advance. What she's saying is, the government, if we can lease hotels for isolation facilities, why can't they do the same to the private hospitals? What do you say to that?
Well, this is a policy matter for the government, you see. But of course, if the government is prepared to, for instance, use the emergency ordinance and so forth, it would make things a bit easier for hospital authority, because they have 5,000 beds. If only they can give us 50% of that, that would relieve our pressure by quite.
At least on the non-COVID patients.
Even if they do not want to accept COVID, at least accept non-COVID, and if they can use 2,500 beds to accept non-COVID, that would give us much bigger capacity without affecting further the emergency services, the other services.
Just at the last part of the show, I'm just referring back to the comment made by Dr. Xie earlier, that he thinks there should be more private healthcare workers in the hospital authority. After what has happening right now, would you say that more funds should be more to go and develop more on the primary line of defense?
Absolutely. I agree. I agree with Dr. Xie. If more private doctors is willing to help out the public health system, things will get much better.
Right. Right. Okay. So, Henry, many thanks for coming to share with us the difficulties the hospital authority is facing and how Hong Kong citizens can support by seeking help when appropriate. Stay healthy and see you next week.